Hi YouTubers, it's next from me messes around with Big Oscar. So usual disclaimers, I'm not a doctor, nor am I a cancer patient, so these videos about cancer are purely general information and just fun information. So I'm not a doctor, I'm not giving you medical advice. I'll put a disclaimer in the bucket below, the description below. Also, I'm not a cancer patient or a cancer survivor, so don't take my videos too seriously, and this is just general information. So anyway, this is going to be about throat cancer. So now, the interesting thing about throat cancer is there is no such thing as throat cancer. What throat cancer is referring to, it can refer to oral cancers and esophageal cancers, but more commonly refers to pharyngeal and laryngeal cancer. So this is cancer of the pharynx or the hypopharynx or the larynx or the voice box, the vocal cords. So these cancers, in most cases, are predominantly caused by cigarette smoking, also sometimes chewing tobacco, and excessive alcohol use, particularly hard liquors, and also occasionally HPV, though less common than oropharyngeal cancer. So, again, not a doctor, big ass cigar of life. So, predominantly heavy smoking, heavy alcohol use. In Southeast Asia, in India, they chew betel nut or pan or gutka or mesir, and that's a smokeless tobacco that is very strongly associated with head and neck cancer. So predominantly, it is associated with tobacco and alcohol use. Occasionally, some debate, whether it's associated with drinking hot liquids like tea at a very high temperature, but predominantly tobacco and alcohol. So the survival rate for these cancers depends greatly on when they're found. Vocal cord cancer, for example, again, I'm not a doctor, tends to be found more earlier because it presents as hoarseness at an early stage. Symptoms include difficulty swallowing, coughing up blood, hoarseness, coughing, clearing your throat constantly, feeling that something is stuck in your throat, having a scratchy throat, coughing up phlegm, big ass boogers for life. That's predominantly the symptoms. And a very common misconception is everybody who has cancer in their voice box is going to need a permanent tracheotomy or a stoma or the hole in the throat. And that's actually not true. So years and years ago in the 1980s and 1990s, that was the standard treatment, was to remove the voice box. Nowadays, over the last 15, 20 years, again, I'm not a doctor, more and more cases of voice box cancer can be preserved. So the biggest advancement in the last 15, 20 years is they are being able to preserve more and more voice boxes. So it's still possible that you may need your entire voice box removed, your larynx removed, and have a permanent hole in your neck. However, it's a lot less likely than 20 years ago or 30 years ago, and the chemotherapy radiation treatment includes chemotherapy radiation surgery. Immunotherapy is a lot better and a lot less toxic. So the answer is not everybody who has these cancers is going to end up, somebody with a hole in their neck going, "Hey God, my name is." So that's the whole point. So it is still possible to lose your voice box, and by no means am I encouraging people, especially people under the age of 18, to go out and smoke and drink. It's purely a adult enjoyment. This is, like I said before, my channel, I am a cigar and pipe smoker myself. I'm somebody who doesn't drink alcohol myself. I'm 27 years old, almost 28. So again, it's not for people under 18, under 21, you get the point. So you choose to smoke, that's your own personal choice as a legal age, quote-unquote legal age adult. So throat cancer is interesting. It's a cancer that is not super common, 15, 20,000 cases each year, but it is the cancer that needs to be dealt with. Big ass year of life, bye.